Hello friends, today we are going to start our discussion on the pathology. This is one among the courses in the third semester of MBBS. So today we shall discuss regarding the definition of pathology and some of the common terminologies used in pathology. Now let's start. What is pathology? The word pathology comes from two Greek words. It is pathos, which means disease, and logos, which means study. It is the scientific study of disease into its nature, causes, mechanisms, and effects. So in pathology, generally, we are studying about diseases. From the nature of diseases, the causes of diseases, which we call them as etiology of diseases, then the mechanism, how the cause of that disease tend to cause symptoms in an organism. That is the mechanism. We call it as pathogenesis. And then finally, the effects of that pathogenesis. So it is essential for all would be doctors as well as general practitioner and specialists. Treatment of diseases and prevention all depend on knowing the underlying pathology in patients. These causes which we are studying in MBBS, they have a very great link. There is a very great link between causes like pharmacology, causes like microbiology, parasitology, and pathology. Why? It's because in microbiology and parasitology, we are learning how microbes and the parasite they cause disease. But in pathology now, we are learning the mechanism of pathogenesis, and in pharmacology we are learning how to kill this microbe or how to kill this parasite without harming an organism. So these causes, they have a very great link. You can't treat disease by only knowing pharmacology. You can't treat disease by only knowing medications. You can be able to treat disease if you know the underlying cause of the disease, and if you know how that underlying cause can be killed, that is based on the study of microbiology and parasitology. For medical students, pathology is a vital bridge between the initial learning phase, including anatomy, biochemistry, and physiology of pre-clinical science, and the final phase of clinical subject. So in the MBBS syllabus, the pre-clinical science includes biochemistry, anatomy, and physiology, and the phase of study which include the clinical and non-clinical subject include the pathology. So pathology helps us to link the knowledge of what we learned in anatomy, what we learned in the microscopic anatomy, which sometimes we call it as histology, what we learned there, and what we see now at the abnormal conditions in the body. So let's start by defining what is the disease. Let's start by explaining what is the disease. A disease is the opposite of health. It is the opposite of health. Now we can say that it is the state of discomfort to the body. This is discomfort to the body. So a person doesn't feel comfortable. Actually, that is disease. If you're not feeling comfortable, that's the simple meaning of disease. It is abnormal variation in the structure and or function of the body. Sometimes it can be abnormal variation in structure and function, or sometimes it can be the abnormal variation in only structure or in only function of the body. As you know from our first semester MBBS courses of anatomy, that the structure of the body, it is referred to as body anatomy, and the functioning of the body is referred to as physiology. Now, as we studied in anatomy, if there is any abnormal variation in the structure or anatomy of the body parts, that means that will be referred to as a disease. And if there is any variation in the function or the physiology of functioning of the body parts, will also be referred as the disease. Now, health can be defined in various ways according to different perspectives of people. As I said, that disease is the opposite of health. Now the question comes, what is health? Health has different perceptions according to different people how they define it. So perceptions of health and disease vary between individuals and professional viewpoints. According to professionals of people and their views or their thought, and some of them even their belief, they tend to define disease in different ways. Some define health, they define disease and health in different ways. Some define health as merely absence of sign or symptoms of disease. Some people, they say, if somebody has no signs or symptoms of disease, he or she is healthier. But sometimes people believe to be ill but have no measurable signs or symptoms of disease. Probably you have met with different conditions. A person goes to hospital and then they take different investigations using microscope and things like that, using x-ray, ultrasounds, and finally they find no problem, but a person feels ill. So how can we define this condition, and how can we categorize this condition? This person diseased or not? And conversely, there are people who believe themselves to be well and have no symptoms, yet on examination they are found with the disease. So some people, they are believing themselves that they are well and they have no symptoms of disease. But if we examine their blood or if we examine their tissue, we are finding cells or microorganisms causing the diseases or parasites causing diseases in them. Now, all of these, there are different perceptions and some kind of confusion in defining health. But there is the universal definition of health which is used, which is the WHO definition of health. This is the state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity. So according to WHO, health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is the universal definition of health, and everywhere when we are categorizing a situation as a disease or not, we are dealing with this definition. That means a person who is not physically, mentally, and social well-being, complete physically, complete mentally, and complete social well-being, he is not healthier. So actually, being healthier include even the psychological issues, and that's why we have the psychopathology, where we are knowing things like psychiatry and the problems which are faced by people who are going to the psychiatry clinics. So a common term confused with the disease is illness. Here I want to distinguish to you, and I want to differentiate what is the difference between disease and illness. These two terminologies, for some people, they don't know what is the difference between them. The difference between disease and illness. While disease suggests an entity with a cause, illness is the subjective reaction of an individual to disease. So disease suggests an entity with a cause. Any disease has its causal factor. Maybe it's a bacteria, or it's a parasite, or it's a virus that is the causal factor for that disease. So a disease has an entity cause, the causal factor. But illness is the subjective reaction of an individual to disease. Let's say if a bacteria enter the body, that bacteria will cause certain kinds of symptoms. What a patient feels is what we call as illness. So illness is what a patient feels after the subjective reaction to a disease, or subjective reaction to the entrance of any microorganism in the body. So if a bacteria enter the body, or if the parasite enter the body, or if the virus enter the body, what is the reaction of that virus? Maybe virus leads to fever, leads to tachycardia. These symptoms are what we call as illness. So illness, they are conditions of the body associated with disease. Usually, the illness can be divided in two terms, either in symptoms or in physical signs. And there is a difference between symptoms and physical signs. You must know about this. Symptom is what we call the complaints of the patient, of a patient. Always a patient, when it comes in the ward, then says, what is your chief complaint? A doctor or a general practitioner asks, what is your general complaint? What is your chief complaint? Chief complaint, that is, it is the major factor which lead a patient to come at hospital. What is your chief complaint? Maybe it is stomachache, it is headache, it is abnormal abdominal extension. What is your chief complaint? So chief complaint is what a patient tend to tell a doctor that I don't feel well this side of the body. And then after that chief complaint of a patient, now a physician start to investigate what is wrong with this chief complaint. What is wrong? So when a patient say that maybe I feel pain in the right hypochondriac region, then a physician start maybe to palpate or tries to find a way by which he can know what is wrong. If a physician know maybe there is enlargement of a certain organ, or maybe there is let's say hernia, that is physical sign. So a physical sign is elected by a physician. A physical sign is not elected by a patient. A patient doesn't know physical sign. A patient simply know about the symptoms. So the study of disease is done in pathology, is how we are doing here. But the learning of illness will be done in the wards. When you are going in the wards, and we see how the patients feel with different disease condition. That is the learning of illness, the learning of symptoms, which are the result of different diseases, and how to treat these diseases. Now we have some of the few terminologies which we are normally using them in pathology. The first terminology, the patient, the person affected by disease. Any person affected by disease, we normally call this person as the patient. And then another thing is the lesion. Lesion is the characteristics changes in tissue and cells produced by a disease. Every kind of disease has its own characteristics changes of the cells. So some of the bacteria, they can lead to enlargement of the cell. Some of bacteria, they can lead to death of cell. Some of bacteria, they can cause different destruction to the body. The best example, which I most often like to give my student in this part, is the example of the Entamoeba histolytica. In the intestine, Entamoeba histolytica cause a wound which is a flask-shaped ulcer. It is called a flask-shaped ulcer because of its shape. So it's let me try to draw this flask-shaped ulcer. We can see this in a parasitology, a flask-shaped ulcer. It's like this way. This is the wound entering the intestine. So this is the intestinal wall. That means this is the intestinal wall, and then this is the distracted part by the Entamoeba histolytica. You see, this is the lesion, the nature of lesion caused by Entamoeba histolytica. Lesion, the characteristics changes in tissue and cells produced by disease. So Entamoeba histolytica has caused this kind of a lesion. Actually, the lesion is not produced by a disease. It is produced by the microorganism, or the microbe, or the parasite causing the disease. And then we have the pathological changes or morphology. If we are examining the diseased tissue, let's say the diseased tissue, the lungs or the intestine, if we are examining them either by naked eyes, That means by gross appearance, or when we are examining them using microscope, that is microscopic examination of tissue. Remember that we already know the gross appearance of different organs from our anatomy, from our gross anatomy, and we know the microscopic appearance of different tissues from our microanatomy, or sometimes you call it as histology. So the knowledge of histology and the gross anatomy now help us in pathology. That's why all of these causes, they have links. You must have the knowledge of anatomy so that to learn pathology and to be successful in passing well your exams. So the naked appearance or the gross appearance of the distracted organ and the microscopic examination of the tissue tells us about the pathological changes, kwamba what happens to the cell after an organism has entered, and what happened to the gross appearance of this organ. Another terminology is etiology. Etiology, what does it mean? Etiology simply means what causes the variation from normal, or what is the causal factor responsible for the lesion. What is the causal factor? Every disease you see in the world, it's because of a certain causal factor. Actually, in pathology, when we are talking of disease, we are talking maybe abnormal growth conditions such as neoplasia associated with cancer, or the diseases caused by the parasites, or even microbes. In pathology, we are not talking of diseases associated with maybe stress. Those are discussed in psychopathology, when we are discussing regarding the psychology of a person and things like that. So what is the causal factor of a disease? Let's say it is the mutagen. A mutagen leads to mutation of a certain gene, and mutation of that gene lead to uncontrolled multiplication or proliferation of cell, leading to what we call as the neoplasia, either benign or malignant neoplasia. So the causal factor of a disease or the causal factor of a lesion is what we call as the etiology. And the terminology is pathogenesis. Pathogenesis is the mechanism by which lesions are produced. How the lesion is produced. An organism, when it enters the body, it finds the normal structure of the body. Now, by what mechanism that organism tend to cause lesion? Maybe by producing enzymes which cause the extracellular digestion, or maybe by feeding, or maybe by attaching. That is pathogenesis. The mechanism by which an organism, or the mechanism by which a pathogen causes disease. Functional implications of lesion felt by patient. Different diseases or different lesions, they can lead to different functional implications. Let me give you an example. When an amoeba causes the flask-shaped ulcer in the intestine, what will be there is that the patient will experience the amoebic dysentery. And feces will be mixed with blood. So this amoebic dysentery is the symptom of a patient. So when a patient see these symptoms, then he visit a doctor and say, there is this kind of situation in my body, I don't understand it well. That is because of the functional implication. So the functional implications can be seen in terms of symptom, which are complaints of patient, or in terms of physical signs, which are the investigations of a physician after a patient has explained it is his or her chief complaint. The clinical significance of morphological and functional changes plus other investigation, because the doctor will be told about the symptoms, and then he will try to investigate about the physical signs of a disease, and then after knowing the symptoms and the physical signs, he or she, a doctor, will expect a certain disease. Let's say symptoms like splenomegaly, and physical signs like splenomegaly and different symptoms like feeling weak, then a doctor can think of sickle cell anemia. After thinking of sickle cell anemia, then a doctor should take sample of blood and going to investigate or give a lab technician to investigate that sample of blood, that the suspected disease, is it exactly the same or not. So the morphological and functional changes and other investigations like a microscopic appearance of tissues or cells can tell us a lot regarding the condition of disease, can tell us regarding the diagnosis. Diagnosis, that means what's wrong in this patient, what does the patient suffers from. That's why we are saying we have diagnosed the patient with malaria, we have diagnosed the patient with diabetes mellitus. So diagnosis is knowing what's wrong in this patient, what does the patient suffers from. And then after knowing diagnosis, we can also know the prognosis. Based on the symptoms and the physical signs, we can know the prognosis. What is going to happen in this patient? The patient will die, or if we give a patient medication, can he or she get cured, or what will happen to the patient if the prognosis. And also treatment, what can be done about it, because now we have already known the causative agent of a disease from our investigations. Now how can we treat this? What can be done about it? And then finally we can know what can be done to avoid disease complications and spread. To avoid disease complications and spread. What can be done to avoid disease complications and spread? Actually, disease is not a major problem in such, but the major problem is the prognosis after that disease. What will be the condition of a patient after feeling some symptoms? And another issue is the spread of the disease. If a disease could be facing only one person and could not be spreading, it could be easier to prevent them, most of them. But as we know that we have a lot of communicable diseases which are spreading very fast from one person to another, so we must also know how can we prevent. That's why actually this, we are not studying this in a pathology, we are studying this in a epidemiology. Epidemiology regarding the different statistics regarding the distribution of diseases, and also we are studying this in parasitology and entomology, where we are discussing regarding different parasites and different insects which spread different diseases. So in epidemiology and in parasitology, we are mostly often discussing regarding the prevention of the disease complications and even spread, more especially spread. But complications, it is pathology. How to avoid disease complications, it is pathology. To know the treatment of disease, it is mostly linked with pharmacology. Knowing how we can kill the microbes or how we can prevent the abnormal growth of the cell, that is mostly linked with pharmacology. So let's discuss regarding the evolution of pathology. Where did the pathology come from? What is the truth regarding the origin of diseases? Actually, the concept of disease, it is old as life itself. So disease, they haven't started today or yesterday. As long as life is there. Since the time of existence of life, disease were there. And in the origin, from religious belief to rational approach, initially we had a religious belief, but then later we had a rational approach, and now we are mostly using rational approach rather than using the religious belief regarding the origin of diseases. So in the religious belief, and initially they believe that disease is an outcome of evil. Eyes of spirit is an outcome of evil. They believe disease is an outcome of evil. Towards them of priests through prayers and sacrifices used to invoke supernatural powers to praise the gods. And actually, by that era, people were cured and they were safe. Not only by that era, even in this era, some of the priests they tend to pray for different supernatural powers which can hold the lives of people, and people they get cured. Now, this was the religious beliefs regarding the origin of disease, and this is more especially for those people who are believing that we are made by God. But the link between medicine and religion became so firmly established worldwide. And the Greeks had Asclepius, the god of healing. The Greeks they had this Asclepius. Asclepius was God by sacrifices. He was healing a lot of people. Later on came the concept of religious belief was replaced by philosophical and relational approach to disease by methods of observation. So different methods of observation now they replace that religious belief regarding the origin of a disease. Important people in medical history which we can discuss. We have Hippocrates. He lived 460 years before Christ and 377 years before Christ. Hippocrates is the father of medicine. He is the father of medicine. He is known as the father of medicine. First thing he did is that he stressed the study of patient's symptom. He was fighting regarding studying about the patient's symptom of different diseases. So what he did is that when he see a patient complains about a certain symptom, then he start thinking what can be wrong with this symptom. So he studied the symptoms of different diseases, and he has major contribution in medicine. He described the methods of diagnosing diseases, and also he wrote what we call the Hippocratic Oath. This is the ethical conduct for all doctors all over the world. They take the Hippocratic Oath as the ethical conduct. Another person is the Cornelius Celsus. Cornelius Celsus lived 53 years before Christ up to 7 years Anno Domino. And the major thing he did, he described the 4 cardinal signs of inflammation. We shall discuss about these cardinal signs of inflammation when we'll be discussing regarding inflammation in the next sessions of pathology. And they were firstly explained by the Cornelius Celsus. Claudius Galen, he said that illness resulted from imbalance between 4 body fluids, which are blood, lymph, the black bile, and biliary secretions. That is his contribution in pathology. So there was some kind of setbacks actually from that time of religious belief and moving to rational. There are some kinds of setbacks. There are some kind of disadvantages. First is the widespread and devastating epidemics reversed the process of rational thinking again. So there were some of the diseases which were very widespread and has a lot of deaths all over the world. So when the scientists they start thinking about these diseases, they came with no answer. So the rational thinking regarding the causative agent of diseases now started to fail explaining these facts, that why are they happening in this way. And also the supernatural concepts and divine punishment for sins dominated again. You know, whether you believe or not, there is the supernatural power which made a person and which made a first man. So as the concept of rational thinking and ideas came, the supernatural concepts because there were diseases which with no origin or investigations they don't reveal any disease. So due to presence of these kind of conditions, now they finally concluded that rational thinking can be true, but why it doesn't give us some answers in some of phenomena? It's because of the supernatural power which controls our life, and the punishment for sins. Uh, but also the another setback in the belief was that life was due to influence of vital substances under the control of soul. Some of people, they believe that life was due to influence of vital substances under the control of soul. Actually, these setbacks they were preventing the truth of rational thinking regarding the origin of disease. In absence of these setbacks, then the rational thinking regarding the origin of disease would be 100% correct. But because we have these setbacks, the rational thinking, it's not 100% correct because it fails to answer some of the questions. Dissection of human body. Dissection of human body was strictly forbidden. That would mean dissection of human body was strictly forbidden. That would mean hurting the soul. So by that time, the dissection of human body, it was strictly prevented. Now, after starting the dissection of human body, the emergence of anatomy and the morbid anatomy, it is the one which has laid a lot of evolution in a pathology, and to lead pathology to be seen in the way how it is seen nowadays. So emergence of anatomy and the morbid anatomy. This was then revival time of learning, or the Renaissance period. The revival time of learning, Renaissance period, began in Italy and spread to rest of Europe in 15th century. Unaona, emergence of anatomy and starting dissecting cadavers. So since there was freedom of thought, emphasis on philosophical and rationalistic attitude strengthened. Unaona, so the rationalistic attitude, they were strengthened day to day. So in terms of development, first what started is the human anatomy, which is the it was in different ways, including the dissection of cadavers, started by the Vesalius Gabriel Fallopius, which described the human oviduct. That's why it is called the fallopian tube. So dissection of human body started by Vesalius Gabriel Fallopius. Vesalius Gabriel Fallopius described the human oviduct, which is known as the fallopian tube because of his name. But also Fabricius discovered a lymphoid tissue in the intestine of bird. So this was the time when the dissection of human cadavers started. Beginning of the start of morbid anatomy, dissection of cadavers by the Giovanni Morgan. He laid down the foundation of clinical pathologic methodology in the start of disease. So he put a foundation regarding the clinical pathological methodology in the start of disease, and he performed the 700 postmortems. So he performed the 700 postmortems in order to know what is the causal factor of death in these people. What is the causal factor of death? So after doing all of these postmortems, then he came up with a lot of the disease symptoms and things like that in pathology. Now let's see the subdivisions of pathology. What are the subdivisions of pathology? Pathology can be divided into general pathology, which is the studies processes without referring to specific organ. In general pathology, this is the one we are studying. We are just studying processes without specifying to a system. Later we shall study regarding the systemic pathology. So studies processes without referring to specific organ system, described it to show fundamental reaction to disturbances in the body, that when this organism enter the body, what will happen, regardless where that this organism enters specifically. But in the systemic pathology, systemic pathology, we are studying diseases pertaining to specific organs and body systems, pertaining to digestive system, to central nervous system, pertaining to respiratory system, or any system of the body. And then number 3, the clinical pathology. Clinical pathology includes both general pathology and systemic pathology. So the knowledge of general pathology and the systemic pathology, we use all of these knowledge in clinical pathology. So it deals with the problems of patient and the bedside, at the bedside. When a patient is hospitalized, what the major problem of a patient is what we are learning in clinical pathology. It deals with the problems of patient at the bedside, includes the start of laboratory tests useful for the diagnosis and management of a patient. A lab technician take investigations regarding the disease conditions, and then a physician receives the results and then interpret the results. What does this concentration of red blood cell tells us? What does this concentration of white blood cell tells us regarding the condition of the patient? How can I diagnose the patient, and how can I manage the condition of the patient or the situation of a patient? So with the advancement of diagnostic tools like microscope and electron microscope, the specialties of pathology has come to include the following subspecialties. They have come to include other subspecialties of pathology. These include the histopathology and morbid anatomy or anatomical pathology. Anatomical pathology include surgical pathology. This is more especially for those who are performing surgeries. Forensic pathology or autopsy. And cytopathology, which is the start of a single cell. So surgical pathology is the start of pathology by surgery. Most often we are saying that surgeons, actually they know the anatomy of the body, but surgeons, they have a lot of knowledge regarding telling the symptoms and medications and things like that, like internal medicine doctor they are doing. So surgeons, always what they do is that if a patient feels a certain symptom, they can just saying let us do a surgery and then let's see what's wrong. So the surgeons, they start in detail regarding the surgical pathology and knowing the condition or knowing the abnormal condition of the body by surgery. In forensic pathology, we are dealing with knowing different criminal cases which can occur, and they are the causal factor. And then in cytopathology, we are studying regarding the cell and different changes which can occur in the cell due to different disease conditions. But also we have a subdivision of pathology which is hematology and blood transfusion. This deals with the start of the blood cells and different diseases blood, including sickle cell anemia, thalassemia in detail. Also we have chemical pathology, including the study of the chemistry or different metabolic disturbances involved with the diseases. As we know that disease, all disease, they are the result of the abnormal anatomy or physiology of the body, abnormal structure or functioning of the body. This abnormal structure or functioning can lead to metabolic disturbances, such as increased amount of hormones, amount of metabolites and different chemicals in the body. But also we have a subdivision of microbiology and medical immunology, also parasitology and medical entomology. Actually, microbiology and medical immunology, it is studied as the separate course in MBBS, and parasitology and medical entomology, it is studied the separate course also. Now, let's try to finalize this session by discussing how are we learning pathology now. As we know that most of the medical students, they don't want to be pathologists. They don't want to be specialists in pathology. A pathologist is the person who only knows regarding diseases, how to study different slides of microscope, how to learn different conditions, and then finally to comment or to diagnose the patient. So a pathologist only knows regarding knowing what's wrong in this patient based on different symptoms and the studies he did. Now, most of medical students, they don't want to become pathologists, or they are not going to become pathologists. Now, why is it important for us to study pathology? Why should the medical curriculum or the MBBS syllabus include pathology, include a course in pathology of undergraduate? Why is it important? Pathology provides a clear account of the causes and the pathological changes, which provide a logical explanation for the symptoms and the signs and biochemical changes which happen in an organism. So every kind of symptom which we see in a patient, it is because of different pathological changes, and we are able to see these pathological changes using microscope. So pathology helps us to link between the symptoms a patient complains, the signs we have investigated, the biochemical changes we have seen in the lab, and then we are linking them with the disease conditions. So that is a very important thing in pathology. Now, how to learn pathology? There are different modalities. As with other courses of MBBS, pathology is no exception to the general rule that learning is dependent on students' own effort. So you must have effort, but the starting of pathology included lecturers, included the small group discussions, demonstration and the practicals, included the clinical pathological conferences and autopsy. So these are the different ways you can start pathology in your MBBS second year. Thank you for your time. Thank you for listening me. Thank you for following my channel, and I beg you to subscribe my channel. I beg you to share these lecturers to other students all over the world who are studying MBBS any country. I took these lecturers, and I use MBBS syllabus to teach these lecturers. So don't forget also to join our Telegram group. The link is in the description below. In our Telegram group, you'll find the slides there, and you'll find the syllabus there. Everything will be there. So don't forget to join our Telegram group for more detail. Thank you, and later wish you nice studies.